First, on CBS This Morning, CVS Health is announcing a major change to show you how you shop for beauty products. The nation's leading drugstore chain will inform customers if certain advertisements for products were digitally altered. A special watermark will highlight imagery without material changes. Those products include things like makeup and skincare items, where photos are edited to adjust to a person's size, shape, or skin color. Now, this is the latest move among several customers' initiatives at CVS. The chain has stopped the sale of tobacco products, you know that, and they've introduced limits on opioid prescriptions. It also plans to buy the insurance giant Aetna. They're very busy over there. Helena Foulkes is Executive Vice President of CVS Health and President of CVS Pharmacy, and joins us at the table to discuss. Very good to see you, Helena.
Thank you.
Does that ever happen to you? People get CBS and CVS mixed up when they're talking about you?
All the time.
All the time?
All the time, from the very get-go. But we love CBS.
Yes.
We're very proud to be at CVS.
And we love it too, but let's talk about the photoshopping, because I happen to think sometimes photoshopping is okay. I will say to the person, I've got 3 rolls on my tummy, can you make it down to 1? But you're saying something very different here. This is very serious what you all are taking on.
Yeah.
Tell us how it works and how it came about.
Sure. So I would say why we're doing this is, first of all, I'm a mother. I have 2 sons and 2 daughters, and I look at how my girls consume media. We're bombarded with media every day, and a couple statistics that really hit us is that 80% of women feel worse about themselves after looking at beauty ads, and 42% of girls in grades 1 through 3 want to be thinner. So I think there's a whole conversation going on, and for us as a big healthcare company with beauty inside, we felt like this was a health issue. In fact, the American Medical Association has said the propagation of unrealistic body imagery is hurting our health.
So we're going to look at the ads, Helena, and see what.
Okay, good.
How is that going to work?
So what we're committing to is that any of the imagery you see in our stores will be real. We'll be honest with you, and we'll give you a beauty mark that will say we didn't digitally alter it. And if we have certain partners who still want to have a digitally altered photograph, we'll just say this has been digitally modified, so that women, as they're looking at photographs, will know what's real and not feel that they have to live up to some unrealistic standard.
Do you expect that in customer behavior that this will drive the way people behave in what they purchase, or just make the experience in the store less oppressive?
I think this is a conversation young girls are already having. This is a movement that's happening. If you look at girls ages 13 to 24, they're on YouTube, and the reason they're going to YouTube is they're saying, I see imagery there that's realistic. And I think if they can go to a store or a website that also reflects authenticity, they'll feel better about us, they'll trust us, and they'll do more business with us.
Interesting. It's almost empowering for young girls. I want to ask you about something else you've launched, and that's same day or next day prescription drug delivery in many cities across the country.
Yeah.
How is that working, and is that a direct, I guess, threat to Amazon if, in fact, Amazon does get into the prescription drug business as well?
Well, everything we do is with consumers in mind. We've always been a consumer-first company. In fact, I remember a long time ago we debated whether we should put drive-through pharmacies in because people wouldn't walk in a store if we had a drive-through. And we said we have to keep doing what the consumer's looking for. So for us, it's about making it as easy as possible. We want people to get on and stay on the right medicines. And we have 9,700 stores across the country, and we can be as close as possible to consumers and get them their medicines quickly. That's what we want to do. So we just started this in New York City. We'll be adding 5 other cities later this year, and we'll be doing nationwide next day delivery this year.
Can I go back to your campaign for a second? Because I'm fascinated by what you said about YouTube. Are you finding that young girls are not looking at models anymore for inspiration, that they look at the YouTube people and think they look just like I do, and that's the look they're going for, not the model look?
Absolutely. They're saying celebrities aren't real. I want to find people who I can relate to, that have my own imperfections, and feel that I'm empowered by the fact that I look like these people. It's a huge opportunity, and it's what a lot of indie brands are doing so effectively, and why they're growing. They're tapping into this empowerment among girls, and that's what we're hoping to fuel with this conversation.
Let me ask you about the opioid crisis. CVS took measures to combat it. How's that working out in your end?
Very well. It's a really devastating crisis in this country, and we feel like we have a real responsibility and opportunity to help. So
What are you doing with the opioids?
So starting actually in the 1st of February, it's a great example of using our pharmacy benefits management company and our retail business together. So the PBM will now have new rules in place. So if you're just leaving the dentist for minor surgery, for example, and getting an acute prescription, will only allow you to get a 7-day supply. And at our retail counters, we'll be educating consumers on the why. And the why around that is after 7 days, the likelihood of addiction rises with every day of use of opioids. So we really want to make sure that if you only had something minor, you just get 7 days supply, and we think that will make a big difference in this country.
You said 80% of your shoppers are women. Talk about their shopping habits in the store. Obviously, people go to a pharmacy not just to get their prescription drugs these days. They get groceries and all else. What does a woman's shopping behavior tell you within the store as far as sales?
Well, I'd say that we're all stressed for time. We're more stressed than ever as Americans, and as women, we wear a lot of hats. We have many responsibilities. We're working, we're taking care of our families. We're the chief healthcare officers of our family. So first and foremost, we're coming with a mindset of taking care of people. The thing that I think is so fun for women about beauty in our stores, it's a little bit of guilt-free me time. And so they can do that, they can take care of other people, but give themselves a little pleasure. And for women, looking good and feeling good are very much connected. People often ask me, how does beauty fit in within a big healthcare company?
Yeah.
Women get it. It's part of how we
I get
feel.
some lip gloss, I'm not going to lie, when I go shopping for other things.
Exactly.
My me time. Helena, great to see you. Thank you so much.
Thank you.